Hi, everyone. I'm James Protin. I'd like to give a special thank you to our sponsors for the podcast. Good morning, everyone, and welcome to the podcast. We have a very interesting show for you guys today, one I'm very excited about. With us today are Brook Ward, who is the CEO of the Washington Health System, and Sara Schumacher, who is Executive Director of the Washington Health System Foundation. Welcome. Thanks for joining us.
Thanks Jamie. Thanks for having us.
I appreciate it. I hope it's interesting.
I think it will be. You guys are doing some really cool stuff, and you're growing, and that's... I mean, it's out there, and your brand is really becoming much more seen and understood. And I think people probably are curious, that old people like me that just remember Washington Hospital, right? So Washington Health System is, when I first heard that was my first question. What is that? What have you done? Have you built more hospitals? What have you done? So could you just start off telling us a little bit about yourselves and how you got where you are and a little bit about your journey?
Go ahead, sir.
So I have somewhat of a unique journey because healthcare has sort of been in my family. My father was the vice president of human resources at the Washington Hospital, and then of course the health system, and he retired after 40 years of service. So I spent my childhood thinking that the only options were nonprofit healthcare because of course that's what you know as a kid.
Right.
And so I thought for a little while I would do that, and then thought, you know what, no, I don't think I want to do that because I want to do something on my own. And so I thought I would be a broadcaster, and of course then the realization of that sets in, and I'm not going to be a broadcaster. I go to IUP, journalism major, looking for an internship. It doesn't go quite right. I end up back at the Washington Hospital. And so it turned out, of course, bringing me here and teaching me about what a foundation is, what philanthropy is. And so my dad was instrumental in connecting me with some folks at the hospital, and my mentor, Rich Mahoney, who was the previous executive director for the Washington Health System Foundation, who retired after a 28-year stint.
Okay.
And so I had the good fortune of working for him for 9 years right out of college and learning from him about what health system philanthropy, what a foundation is, and the support that it can offer to a supporting organization. And left there after 9 years for growth and development, went to another independent community hospital, and that is how, of course, you and I met, which has been 10 years now, if you can even believe that.
It is hard to believe.
And so I was the vice president of fund development for Monongahela Valley Hospital.
Okay.
Rich retired, as I mentioned, and so, again, looking for some more growth and development, so I ended up leaving there and was hired by Brooke and Gary Weinstein to be the executive director of the Washington Health System Foundation. And hard to believe, but I have been there now for 4 years. I just hit my anniversary. So
good for you. Congratulations.
Yeah, so I've spent 20 years in healthcare, hospital, philanthropy, and it's what I know, and it's what I love.
And you found your way home now.
I did find my way home, which is what Lou Panza told everyone when I left Mon Valley. But it's the truth. It's really initially where I thought I would end up and be, and the stars aligned. And if you shake a magic 8-ball and you look at it, it's kind of the story that was written for me. And I'm glad that it brought me back.
That's wonderful. And it is. And you can tell that this is something that's in your heart. That was the first thing that was always jumped out at me about you, is how much you loved what you do, how much you loved people, and how much you loved what you did. And you did good work there, and you're doing great work here. So
thank you. I do love it. I have a serving heart, and trying to show that to my daughters so that they get some piece of that from me for their future. So I do love it.
Yeah, that hit me between the eyes when I saw Billy a while ago here, actually, and he told me that your oldest was playing high school basketball.
Yes, I am old enough for my oldest to be in high school, and that's probably the biggest reality check for me. And I can say I've been working for 20 years, and that's also a reality check for me.
That is awesome. Well, thank you. And Brooke, how about you? How did you choose healthcare, or did it choose you?
I think it's a little bit of both, and our stories might be a little bit similar. I heard you talking about your background before we started the podcast today. I grew up in Michigan.
Okay.
Was originally going to go to University of Detroit for something entirely different out of high school, and decided partway through my senior year that, I'd met the love of my life and I wanted to get married. And I didn't think I could do that and go to school at the same time. And so I ended up joining the U.S. Air Force and was in the military for a time period and married my wife. We'll have our 33rd anniversary this Friday. Actually.
Congratulations.
And so we were a little bit unusual in the sense that, going into the military, we knew that wasn't going to be a career, but it was a good pathway. And then from there, sort of looking for what next. And in the Air Force, I was fortunate enough, they made me a firefighter, and part of that became becoming an EMT and working on the rescue truck. That sort of introduced me to healthcare in general. As it turns out, everybody in my wife's family, except for my father-in-law, was in healthcare in some way. And I grew up around photography. My dad was a professional photographer, and so I had some brother-in-laws through my wife's family who worked in radiography. And I was looking for something I could do, use the GI Bill, go to school quickly, get out, get a degree within a couple of years and support my family. And so I spent a day or so at a local community hospital with my brother-in-law looking at what he does in radiography and realized it's just photography done differently.
Sure.
And it was a 2-year degree. And of course, this was prior to the internet. I'm much older than Sarah. Prior to cell phones, texting, those kind of things. So everything was done through the mail. And I was accepted to a state university in Michigan to do a radiography program. But at the time, what they didn't tell you is there was a 2-year waiting list. So we get out of the military, we transport the family up to Michigan only to find out I'm in the program, but you have 2 years to wait. And so I actually did my undergrad in hospital administration, business first.
Okay.
I did my junior and senior years first, and then I did the radiography program. And it was partway through that second year of my clinicals for radiography that I realized it was a great profession and a great career, but it wasn't going to be something I wanted to do for the rest of my life.
Sure.
And so upon completing that, went on immediately to a master's program at Grand Valley State University in public administration. And finished that, and I was working at Spectrum Health in Grand Rapids, which for the folks around here, that would be equivalent to probably UPMC.
Okay.
And worked at their 700-bed level 1 trauma center as a pediatric radiographer, and then became a manager. And some years later was recruited down to Bronson Healthcare Group in Kalamazoo to be their director of radiography, and eventually became a VP there. Okay. And somewhere along the line, maybe a similar story to what Sarah would talk about, decided I wanted to be a chief operating officer. Okay. And I had a choice. I could stay there, and I think I had a good shot at getting that role at Bronson at some point, but it was going to be quite a ways down the road based on the incumbent, or I could look. And so our son at that point had been in college a couple years. The timing was right. And so we started looking, and I found a home here at the Washington Health System, came here as the chief operating officer in 2010 and executive vice president. And then most recently, right before the pandemic, Gary Weinstein, who was the CEO of the Washington Health System, retired in July of 19, and I was fortunate enough to be selected and promoted to be the CEO of the health system just prior to this little thing called a pandemic. And so I had about
inherited that.
Yeah, I had about 8 months of operating as the CEO under normal circumstances, and ever since then it's sort of been battlefield conditions. Yeah. And so, I don't know if that's as deep as you wanted to go, but that was some of the history.
That's fantastic. And just as a sidebar, our youngest son's in the Air Force. He's 11 years in, so he's going to stay. He's going to stick it out. So.
Yeah. So 33 years this Friday, and our son is 32.
Good for you. Good for you. That's fantastic. So, Washington Health System. Can you give us just a little bit about what was the vision behind becoming a health system? You have a community hospital, Washington Hospital, which was a great hospital, had a great reputation. But what was the vision, the thought process behind that drove it that direction?
Well, one of the things that struck me when I came to 2010 was it was already a health system. We're celebrating.
They just weren't calling it that.
We were celebrating and are celebrating our 125th anniversary this year. But you had the Washington Hospital, which is sort of the original entity. And I should mention, by the way, the School of Nursing was created the same day the hospital was created in 1897.
Is that right?
So we've been involved with teaching people in the health profession since the very beginning, and that school still exists. But you had the Washington Hospital, and that was sort of the legacy name that existed. Mm-hmm. You have the hospital down in Waynesburg, Washington Health System Green, which we acquired from a for-profit health system in 2015. You have the Wellness Center, the Cancer Center, there's 18 joint ventures, all the physician practices. Most people don't know we have multiple entities. I think there are 6 entities we own entirely with about 2,300 FTEs, about 2,700 people that work for us. But when you add all the joint ventures, it's over 10,000 employees covering services from Harrisburg into Ohio, Morgantown up to Erie. Wow. And so it's more than sort of that traditional Washington hospital.
Sure.
And so you're trying to get beyond that sort of little hospital mentality and create a vision, a brand for what the entity really is.
Yeah.
And so that's the point of changing that about 8 years ago from Washington Hospital to the Washington Health System. We need to operate from a systemness perspective. We need to behave and do what's right. And Sarah's holding up the latest brochure, which sort of highlights the timeline of those 125 years.
Which is not even all inclusive of what Brooke just mentioned. These are the highlights of some of the big joint ventures, and some of the philanthropy helped with some of this as well. And of course, we highlight that.
That's amazing because, I've lived here my entire life, for almost 63 years, and I didn't know that. I knew about the Greene County thing because I was part of a comprehensive plan we did in Greene County, so I knew all of that. But I didn't know that scope. That's fascinating. I mean, I love that. Yeah. I mean, that's great.
And most people don't realize that the hospital in Waynesburg was going to close.
Right.
It operated as an independent nonprofit hospital for 60 years. And back, I think, in 2005, it decided to sell itself and become part of a for-profit hospital chain. It was owned by Regional Health out of Tennessee for 10 years. And at the end of that 10 years, which was their minimum commitment, they had shopped it to everyone. They had tried to sell it, give it to WVU, UPMC, AHN, you name it, everybody passed. And we went in and we actually acquired that organization for $1. And so we had the privilege of handing Regional 4 quarters. But it wasn't about acquiring another hospital. I mean, there are challenges with the infrastructure of having a hospital like that.
Sure.
It was really about protecting the core services for that community, maintaining the emergency department, acute inpatient services, a lot of the outpatient diagnostic services that would have went away entirely. Everybody in Greene County would have had to travel then to Morgantown or up to Washington or over to Uniontown for care, and they can continue to get that in place. And so we've been running it since 2015. It's doing great, and we've actually increased the quality of care there. So for the last couple of years, Washington Health System Greene has gotten an A grade from Leapfrog, which is an independent organization that rates hospitals. The Washington hospitals often, over the last 2 decades, gotten an A or a B, but we hover in that area. We've always done great. But up until the last year, Greene had never performed it that well. And so not only we made it sustainable, kept core services in Greene County, but we've upped the quality there as well.
That's amazing. That is amazing. So can you talk about the difference between a community hospital and an academic healthcare system? What exactly is that difference? I mean, because when you think about my exposure is Mon Valley Hospital, which is now Penn Highlands, right? So that's growing up my entire life. That's been my hospital. That's where I go, right? My family's entrenched there. I've been involved for a very, very long time. So how does that compare? I mean, this is obviously a much larger footprint and a much broader scope. But it is, when you look at community hospitals, which, by every indication I have, they're becoming a thing of the past. They're like dinosaurs, right? So is this growth something that it was necessary for survival, or is it a business decision?
Well, I think it's an interesting question. And, from my perspective, the Washington Health System is grown because the community needed it. And so the difference in my mind between community healthcare organizations and I would say tertiary care, because the reason I'm making that distinction is we are an academic organization as well. So we have graduate medical education programs. Right. So I mentioned the School of Nursing created in 1897 when the hospital was created. That has existed during that entire time period. Right. In the early 1900s, we had a training programs for physicians called a rotating internist program. So physicians would graduate from medical school, they would come and rotate and sort of learn on the job. That continued up until 1974 when we created the Family Medicine Residency Program, which was the second family medicine residency program in the entire state, and that program still continues today. So we have 21 residents going through that program. We also have 2 fellowships, one in geriatrics and one in palliative care. And then, of course, we have interns and externs in just about every specialty, both on the medical staff perspective, but also nursing, pharmacy, et cetera. And so, we're not, I would say, just a community hospital, because
Right.
we have this academic arm that most people don't even know about.
That's exactly right.
The difference, I think, is we do everything that AHN, UPMC, et cetera, would do, except we don't do major trauma, transplant, and brain surgery, craniotomy. Otherwise, we do everything here. And so when you think about it, minus those things, what's different? It's really the culture, I think. So when you look at our team members, how we interact with the community, our perspective, it's the culture that's different. If you go to some of those larger organizations, and they're all fine quality organizations,
Sure.
there's so many people and so big, they don't even know each other. And so no one's going to greet you when you walk down the hall. No one's going to know
Right.
you. We're a large, small organization, if that makes sense. And so people know
it makes
each
perfect
other.
sense.
And it's more like a family and less like a corporation. So when you're walking down the hall, you're working with and dealing with people you've dealt with for years.
Right.
You're caring for your friends and neighbor. It's not some stranger who happened to show up from Erie who's here to get care. It's people we know and care for.
Right, and you're big enough, with all of this, that, you don't lose anything, right? You have a couple of things that you just mentioned that you might be able to get at UPMC or WVU Health, medicine, but honestly, those are serious specialty items, but I love, and I've always loved to be able to interact with people that I know. Right, and you walk into a coffee shop and you see a familiar face, somebody that and then if you are unlucky or whatever, but blessed to be able to go into the emergency room and see some of those same people that you see out in the community, because they're part of you, right, and you're part of that hospital community.
And the good thing is, not only do we have all those things, but I put our quality up to theirs any day, and we would perform and come out on top.
Absolutely. So what and this would be really for you first, Brooke. You obviously, in your role as CEO, have a vision for what comes next, right? So in your vision, how does your vision continue, or how do you increase the impact that the health system is going to have on the community?
Well, I think it starts a little bit with stepping back and trying to figure out what does the community need and how does that vision evolve. And so, like all nonprofit hospitals around the country, we do every 3 years a community needs health assessment, which is a deep dive into what's going on in our community, what kind of health issues are they having, what are the social determinants of health, where are the barriers to health. That includes everything from healthcare as we think about it, but from availability of healthy foods, diet, exercise, transportation, you name it. And then we try and drill down from there and say, okay, based on what our community needs are, what are we going to provide from a healthcare organization perspective? And then that helps formulate what our vision statement is. And our vision today is to be a locally governed, i.e. we don't want to be acquired, merged, or sold. We want to remain a locally independent health system. So to be locally governed leader in healthcare quality, safety, and value. And our board has divided leader to be in the top decile of everything we do. So that's our goal. That's incumbent upon our team members to try and do. It doesn't mean there aren't things we can improve. And there's clearly things.
You can always get better.
There's clearly things beneath the top decile, but there's lots of things we're doing that are in the top decile. And where we're not in that spot, we need to work on improving it. And the focus is really around quality, safety, and value. Quality is not only the art and science of healthcare. Did we get the right diagnosis and treatment? But it also means, did we do it efficiently? And were we polite when we took care of a patient? So if we got the right diagnosis and treatment, we did it quickly, but we were rude, that's not good quality.
Yeah, there's more to healthcare than the clinical.
Exactly, and if we got the right diagnosis and treatment, and we were really friendly, but it took 10 days longer than it should have, that's not good quality. So that's where we're focused from a vision perspective, to try and make sure we provide really great quality for the services we provide, because we don't think people need to travel long distances for the care we provide. But part of it, as you highlighted, is making sure they're aware that it's available here.
Right.
And then when they come, they have a great experience and they get good quality.
Excellent. So, Sara, my friend, you are responsible for the foundation, which equates to philanthropy, which equates to money, right? So how do you, your vision for the foundation, how does that support what your CEO just said?
So as he was talking, I was thinking, the foundation weaves into all of that. So, of course, we're a supporting organization of the health system, and so we wait until they're done looking at what is the vision, what are the goals, what are the needs, and looking at that community health needs assessment is part of it. And we want to be the preeminent local foundation who empowers donors and community members to impact healthier communities, which really is what the health system is doing. It's no longer inpatient care only, as we just talked about all the facilities and partnerships that Brooke talked about. Right. So it's about our youth. It's about the future of our communities. And so what we do is we look at what are their needs, and we see where is the piece of the puzzle that we can help fill in. Where is the $2.5 or $3 million cash deficit that we can provide to them? And so that comes in varying forms, as we know. That comes in programs, that comes in staffing, that comes in things for our patients, things for our families that support them. Just through COVID, we've learned that there's a lot more needs than what we ever thought there were. And Brooke talked and touched upon transportation and social determinants of health. And, those weren't things 20 years ago that we were really talking about as a foundation. We were talking about buildings and programs and people in a different way. And so we're looking at what piece can the foundation fill that is even beyond creating new buildings, which we could talk about for an hour, the OB campaigns and, the big projects that we've done. But I think as a whole, people don't realize the small things and the ways that we can touch people, because typically the small things are the most important things.
Absolutely. Absolutely. And I'll give you an example here, because, I've always done what I could do. Right. And I have never been somebody to write a $100,000 check. I work for a living. Right. But I've never.
Most of us do.
Right.
If he could have, I would have already gotten it from him, to be fair.
So, she squeezed everything out of me that she possibly could. But and I enjoyed it. It was great. I mean, because I was able to.
Made you happy.
It did. It did, because I was able to give back, right? And at a pace that I could afford, right? And if there was a time when, we did some fundraisers together, right? So I would, if I didn't have $1,000 laying around, right, in expendable cash, but we needed something, so we'd get some people in the community together, and we'd do a little fundraiser at a place like this and raise the money we needed. But that not only helped, it allowed me to say, you know what, that's my people, I'm helping, right? But it also enabled me to meet and get to know people like Sara and so on and so forth, and people at the hospital that I didn't know, right? Because, most people, the hospital, they go there, they have an emergency, they're hurt, they're sick, so they don't really get to know people beyond that clinical piece, right? So when you can interact in the community like that and feel a part of something, okay? So how do you say to the average person, that you can make a difference? Your $100 or your $500 makes a difference in this gigantic organization. How do you explain that to the average person?
So I think you just started and did a great job talking about what is meaningful to you. And so the best thing and most genuine thing I can say to someone is the impact that you make is what is meaningful to you. And if a $25 donation is meaningful to you, then it's meaningful to me. And it's meaningful to the health system. And if we take 1,000 people's $25 donation, now we have something that can really impact our patients. It can impact our health system. So, we can talk about the $7 million renovation of the Care Center for Family, Birth, and Women's Health, and you can look at that as a community member and say to yourself, wait a minute, I can't give $7 million. No one gave $7 million. It took hundreds and thousands of people to come up with that. So I think the analogy is really, giving something that makes you feel good, and then us taking it and using it for one of the needs that the health system has. But it's going to take all of us. Absolutely.
And don't you think that, and do you think, I guess, that most people associate philanthropy with a big number?
Correct.
Right? You don't associate $100 here, $100 there with being a philanthropist. But if you give anything, okay, to a nonprofit organization, a charity, you're a philanthropist. That's philanthropy. That's what, by the nature of it, is what it is.
I absolutely agree. And we get people who give $5 a year continuously, and that's what
that's wonderful.
Is Sarah's definition. That's significant to them, and so therefore it's meaningful. And the community has a long history of this with us. if you think about our history, looking at the document that Sarah had here, the 120, we started in a house downtown. And that's how the hospital was created, and it operated in a couple different houses. There was an expansion. But in the early 1920s, there were two little hospitals in town, the Washington Hospital and City Hospital, and they decided to merge them together, but they wanted a proper facility. They didn't want to operate out of a house anymore. And so even back in the 1920s, you think about this, the community came together through philanthropy.
Right.
The Wilson family donated their farm, which is why we have Wilson Avenue in front of the hospital.
Is that right?
They donated the farm, and within a week, the community, literally hundreds of people gave money to the point they raised $800,000 in a week. And that's why we have the Washington Hospital.
In the 20s?
In the 20s.
Which
think
now
about
today
that.
is an astronomical amount of money.
Exactly.
That's insane.
So we're still using that facility. If you come to the Washington Hospital, that original facility that opened in 1927 is still there. My office is in part of that building as it speaks today. The behavioral health, radiology,
Yeah.
others.
That
And then
is so
there's
cool.
been one addition every decade, with the exception of the last 10 years, onto the Washington Hospital. Much of that, a vast amount of that came through donations from the community. And it's $5 here, it's $100 there,
Right.
$1,000. And of course, you have the occasional big donor who
Absolutely.
give $100,000 or $1 million. But, and they're important, don't get me wrong, but it's everybody that makes the difference. You know, and so it's been ingrained in our culture, in our community, in Washington, Greene County since the very beginning.
Yeah. I used to tease Sarah. I'd ask her, how much do I have to give to get my name on a building? And she'd give me a number, and that's going to take a while. You're going to have to be patient.
We're going to have to do a lot of fundraisers.
You're going to have to be patient with me.
You're going to need to do a lot of podcasts with a lot of advertising.
Exactly.
Right.
Exactly.
But you know, it engages the community, and that makes it not only family, but it makes it enjoyable, right? It makes it enjoyable, so you don't mind writing that check because you feel a part of something bigger.
Absolutely. And our goal is to educate people through storytelling. And you're a great storyteller. You're a better storyteller than I am, probably. So maybe I should hire you to help tell the story that you just told here about how I twisted your arm. No. But, you know, it really is about education. I took some time and did a career day presentation to a bunch of elementary school kids. And I told them all they were philanthropists, because they are. They said that they had raised money for their soccer program or sold tickets for a fundraiser for a student that was sick at school. And so I think my goal was to just show them the word.
Yeah.
And joke about how long it is and what does it mean, and you know, but a philanthropist is all of us. If you have a serving heart and you give back and you volunteer and provide that value to someone who needs it, you're a philanthropist. And so we need to get people thinking more and more about that word and about
Right.
what that means, and that they feel good about it.
Right.
Everyone thinks that our major giving society, our 1897 society, which Brooke and I are both a part of, you know, people say, oh, that's an elite group. And it's an elite group because it's a group of leaders who believe in giving back to our community.
Right.
But I'm a part of it. And if I can be a part of it, other people can be a part of it.
Sure.
It's definitely attainable to set goals for yourself and want to be a part of the health system in a bigger way, and finding ways to do that, whether it's through fundraisers or it's just writing out a $25 check. And that's all meaningful, not to us, but to our community. It's not for Brooke and I. We have to take ourselves out of the equation when we're asking Jamie Protin to support our clay shoot, because we know it's not for us. It's for the people who receive the services here.
No, and you're right. And, you know, I love that. Philanthropy is not for the wealthy. It's for every man, every woman,
is.
every person. You know, we're all philanthropists, and that's amazing. I'm fascinated by the business of healthcare. Okay, because
So are we.
it's obviously I've been in business for a long time in the engineering space, right? Engineering industry. And I do business development, and I thought that was complicated until I started looking into what, and talking with Sarah and people like her, what it takes on the business side to run a hospital. Okay, you know, the clinical is one thing. You have to have good doctors, you have to have good nurses, technicians, and all those things, and you do that. But the business side of this is ridiculous. I mean, it is so complicated and complex because there's so many moving parts and so many different audiences that you have that you're working for. So, from the standpoint, and I want both of you to answer this. You're looking at it from a different perspective of her, right? So you're one of the major employers in this part of the world. right? With the number of FTEs that you have. So you have to that's first for you. You have to make sure you take care of your people, you meet payroll and all those different things, okay? So you can't be looking at your general fund and thinking, oh, I'm gonna build a building out of this. No, these people can wait to get paid, right?
Right.
So from that perspective, how would you think that, in your words, that the business of healthcare is different than manufacturing widgets, for example? You still have to make payroll, you still have to do all of those things, but a hospital system, just the ecosystem of a hospital and the way your employees interact in that ecosystem is completely different than just about any other sector of the market.
Yeah, I think as you talk, I'm thinking about the conversation I've had with numerous board members over the last couple of decades, and all of them come from great educational backgrounds, different industries. They're all the cream of the crop, right?
Right.
Almost to a person, every one of them, when they get into their board seat with our health system or in my prior roles at other organizations, they realized pretty quickly that they thought their industry was tough until they got involved with healthcare. And I honestly, genuinely believe it's the most difficult industry in our country because of the working environment. And it's different from other industries in the sense that it matters. What we do has an impact on the community. It's not just about economics, right?
Right.
We employ a lot of people. We provide a lot of services. We buy things from the community, like all businesses, and that helps the community. But we literally touch people's lives, and we
Right.
improve the life of our community every single day, either by preventing illness or curing disease and illnesses, those kind of things. And so if it goes away, the community is harmed more than just
Right.
economics.
Right.
On top of that, it's different in the sense that we don't get to set our rates. In every other industry, if inflation like we're seeing now goes up, you could just increase the price and the consumer pays it. That's not how it works in healthcare. And so the federal government sets a baseline rate for Medicaid and Medicare, and all of our contracts with the other payers, UPMC, Highmark's, Aetna's, United, et cetera, they're based on that Medicaid and Medicare fee schedule. It does not matter what happens with our costs. Our fee schedule is fixed. And so you can't just say, well, geez, electricity costs 5% more today, we're going to up our price. It doesn't work that way in our industry. And I do think hospitals and physicians really get a black eye because we talk about the expense of healthcare in our country and the amount of GDP it takes up, and it is alarming.
Right.
But when you break it down, and I hear this a lot from local business leaders, they get their renewal for their health insurance for their employees from whatever payer they're using, and they're saying, well, geez, our health insurance went up 15%, 20%. I even heard one recently, 40%. None of that comes to us because our rates are locked in and structured. So that's going to insurance companies, that's going to pharmaceuticals, that's going to other things. But I think because in the industry, hospitals and providers are the biggest segment, we sort of take it on the chin. And that's why across the state and across the country, a third of every hospital is losing money. The next third is basically barely breaking even. And then you have a fortunate third who are making what we would consider in healthcare a healthy profit margin, which is 2 to 4%. And in any other industry, you wouldn't go into a business to get 2 to 4%.
No,
you
not
want
at
to
all.
shoot for 20% operating margin or greater. So in healthcare, we're operating on really thin margins if you can make it at all. And so it's just extremely difficult. And like you said, you're trying to keep people employed, keep the community healthy, take care of people. You have to pay for all these things in an environment where the revenue doesn't necessarily follow.
So let me go back to my original question. Why did you get into healthcare in the first place?
You don't know what you don't know until
Well, I like the industry. It is a challenge. There's no doubt about it. But, I can leave every day going home feeling like I impacted our community
made
in
a
a
difference.
positive way.
You made a
And
difference.
it's not the same as a nurse or sometimes a physician or an x-ray tech where you're going to take care of 10 patients today and you might get to see the results. What we do in management is the long game, right?
Right.
We're working on trying to set up the business, the healthcare side of the business to succeed long term.
Sure.
And everything we're doing every day is sort of for the long game.
Right.
And so you have to sort of be comfortable with that because you don't go home at the end of the day saying, I took care of 20 patients and my list is done. The list never gets done.
The list never gets done, but you can see the progress.
Exactly.
Right? Because you're invested in the long game.
Right.
Right?
And I think sometimes at our administrative retreats, about once a year, one of those, we'll take about 30 minutes and we'll say, what happened over the last year? What good happened? Because it's easy to worry about sort of the firefighting day to day, the problem of the day, the problem of tomorrow. But you sort of forget that you've been making course corrections all along, and the ship is turned in the right direction until you sort of do that retrospective review.
Yes.
And I think sometimes you need that to sort of remember, because it's easy when you're playing the long game to sort of forget. It takes a while to turn the ship and get it in the right direction.
Sure. Well, how does that impact your day to day? What, when you go to work in the morning, right? Having what he just said, how does that impact you?
So I was thinking when Brooke was talking, yes, this is what we can't explain to people. And I mean that in the sense of, if we send you a solicitation in the mail, how do we explain that to the average donor? How do we get that across to make you understand that philanthropy exists because we need to offset the shortfall, that even when you come into the hospital and you think you're paying that bill, that still doesn't give us enough of the backing to be able to go and renovate units, which are not funded by insurance. It's like, I kind of equate it to having a checking account and a savings account at your own home, right? You know what your bills are and you know what you're going to pay. The savings account sometimes is what I think of the foundation, where we're the ones who can come in and say, okay, Brooke, you need $60,000 for X, Y, and Z. Let's look at the funds that we have. Let's look where the donors have designated, and let's take that money and put it toward that. Or we have a donor who comes to us and says, hey, I really care about oncology. And then we go back to Brooke and say, hey, what in oncology do we need? And then everyone in the organization becomes excited because they think, oh my gosh, the community cares enough about us that they're gonna give us their own hard-earned money to be able to fulfill their legacy and their dreams. But then it's also going to help how many people. So for me, philanthropy goes both ways. It helps Brooke and the administrative team to fill the gap that they may have in looking at, we get to be the people or the heroes who come in, but we don't do that without the real heroes who are the donors who are giving us the funding. And then on the other end, and you're obviously a philanthropist because we've been talking about that, but you know what that feeling is when you're able to give to an organization where you feel like you trust the administration and you trust the impact that it's going to have on not just you and your family, but how many other people. So again, we're not funding widgets.
Right.
We're funding people, and there's nothing I can give you back other than a great feeling about yourself and the legacy of you and your family. That's what we're selling. A feeling.
You guys are not in the medical healthcare business as much as you're in the people business, right? Caring for people, but you're in the people business because that's the core of everything that you both have said that you do. You're driven by the people. I mean, that's... Well,
not only the people of the community, but of course our Washington Health System team members. And as you mentioned, we're the largest employer in this entire region, so you have that. But labor, our team, the most valuable asset we have, they're our biggest expense as well. And so it's all about how do we care for the community with the resources we have, and the resources, the talent, are the people that make up the Washington Health System.
Now, do you guys? Because we did the Protin Award and those things at Mon Valley. Do you guys
I was
do
thinking
anything
about
like
the
that?
Protin Award. We do not
Do you
do anything
acknowledge
like
the,
the Protin Award. We do a service banquet for the staff each year when they meet each one of the milestones, just like we did at Mon Valley.
Okay.
But we do not have an employee award. He's talking about. It's actually dedicated to his uncle.
My uncle.
Uncle
It
Ed.
had nothing to do with me. I just happened to have the name, and I felt guilty because I wasn't doing enough. And that's what originally got me and Sarah
I
connected,
remember.
because I thought, this is. I didn't do anything. He was a successful businessman, a wealthy guy, and he did a lot, right? But I thought it's a legacy thing, right? I mean, he never had any children, and it's the name. So we got involved and found a way. And again, it was a creative idea on her part as to how we could get involved with the community and support the hospital. And my grandkids to this day still love to go and present that award, But and I'll never forget the first time that I gave it. I actually got scolded because I peeked in the envelope. I think it was you that smacked me. It was a surprise.
It's a surprise.
So,
I handed you the envelope and said, "Please don't open it."
and I
no
did
one
anyway.
else
I
does.
looked at it. But
Well,
so,
we have hundreds of ways, though, to recognize and reward staff. And
that's
so
where I was going.
it's all about trying to make sure that they know that they're doing good work and recognizing individuals. And even from a philanthropy perspective, sometimes we have to connect the dots for our team saying, we've just got this new of our auxiliary who donated $200,000, or courtesy of 100 people that donated it.
Right.
And I think that helps as well because they get a chance to sort of understand and realize that it's not just us. I think sometimes in healthcare, particularly when you're on the front line during COVID, you think, we're here alone. But in reality, you have the entire community sort of backing you up. Even if they're not sitting there shoulder to shoulder, they're doing it in other ways. And sometimes that's through a food donation, sometimes it's through money donations, those kind of things. But it takes all of us. And we do have a little unique award called the Presidential Achievement Coin. And this is sort of built off that military tradition of a challenge coin, that the military uses to sort of honor someone who goes above and beyond. So right before the pandemic, we created the Presidential Challenge Coin. And we've given that out very selectively because we want to make sure when we give it out, it's meaningful.
Yes.
And so, we have little things like that to help recognize and reward people as well.
And that's great because, when you're talking about clinical staff, nurses in particular, right? I don't know that I have more respect for nurses than I could even possibly articulate, right? Doctors are great. We need doctors. Doctors are they're brilliant, but wow. I mean, I can't even imagine being a nurse, right? And that's what kind of led me to that question is, these people, like you said, they might see 10 patients a day, and those usually you're dealing with people who are at their worst. They're sick, they're hurt, and to be able to recognize that, and again, that ties to the foundation and philanthropy and the community supporting the hospital.
Yeah, and I think it goes beyond nurses, and no disrespect. Matter of fact, I love our nurses. And,
You're right.
And of course, our physicians and our medical staff are great as well. But the nurses and the staff at the bedside are with the patient all day, where the physicians have to see multiple people and they come and go. But so you have our nurses, you have our LPNs, you have our care partners, our emergency technicians, our patient transport folks, our nutrition service people. These are people that go up to rooms, interact with patients, take orders, go get their food, bring it back. Our EVS, it's everyone,
Even
including
maintenance.
accounting, lawn care, etc. We haven't even talked about our mission statement, which is to provide great patient care. It's a few simple words. And we keep it that way because it doesn't matter whether you have a direct clinical role or if you're on the maintenance crew who takes care of the lawn or someone in my role. We're all there to provide great patient care, either directly or indirectly.
And everybody's doing it. Everybody in the organization
Exactly.
is involved with that because everybody in some way is touching every patient that comes through the door.
So our doctors are important, our nurses are definitely important, but every one of those individuals are important because you can't provide great patient care and do what we do for the community without everyone.
Right.
And there's another group which Brooke touched upon, which is our auxiliary. We have a volunteer group at Washington Hospital, and we also have one at Green. And to the point of 125 years, these two groups have been serving our community. Obviously, people have come and gone, but they have been providing hundreds of volunteers provide, I would say, assistant care to and our team members at Washington Hospital and at Washington Health System Green. And they may be the person who greets you at the front. They may be the person who comes into your room to ask if you need something. They work the gift shop. They do everything for us. And, to Brooke's point, it takes all of us. And so it takes volunteers as well as paid staff members. And some of them have been so dedicated. They worked through the pandemic and they're working in a work shortage crisis when we see we can't get people to come in and be paid to work. But we have 200 community members who
That's
are coming
amazing.
in and they're giving us their time and they want nothing back from us. And so I think that's pretty awesome. And so for me, that's philanthropy in and of itself.
Absolutely.
That group of
Absolutely.
humans who want to give back and receive nothing except that feeling and that goodwill and knowing they've done something good in the community. And then the other thing, to Brooke's point about the staff, we do an employee campaign as well. So we ask the community members to support the organization financially. We ask organizations. We clearly receive funding from foundations, but one of the core group that we receive funding from are our employees. And I can't think of any better statement than to have the very people that receive a paycheck from you feel so inclined that they want to give a piece of that check back as part of their contribution to the community. So our community supported them mainly where we've seen it and been recognized and spotlighted in our healthcare heroes was through COVID. And I think COVID did healthcare a service. Service, not a disservice. Brooke is going to disagree because he has to balance the budget with our CFO, Lisa Rucker.
If we could do without the pandemic, I would have done without it.
I hear you. But I feel like it did healthcare a service because what other environment could we have the entire nation have a spotlight on one industry and giving us such credit for what we do. And I say we because, I also, as I say, drink the Kool-Aid and believe that I'm part of the healthcare that we provide.
Takes a village.
I don't.
That's been the theme of what you guys are saying. It takes a village, right?
Right. Even when we don't see patient care, I fully believe I'm part of healthcare and impact what we're doing every day. And if I don't, I shouldn't be in this role because
that's very true.
That's what it takes. It takes the belief and the dedication to know that what we're doing every day is more than talking to other community members, asking them for their money. It's not about that. It's about asking them for their support for all the things that we talked about to impact our community, which most of the time is them. We're going to take care of them and their families, and they know that, and they trust and believe that their financial support is going to be here for the long haul.
And I'm glad you said that, because I have never heard you or anybody in your role, and I've been around other different organizations, healthcare organizations, but I have never heard you ask anybody for money. Okay, you've never said, "Hey, I need a donation."
I have.
I have asked people for money.
But at least not around me. But that's where it leads to. But it's not that just.
Well, that's because we often think that in fundraising it's about asking people for money, but I always joke that's the easiest thing that we do, because the prospecting and the stewardship and the teaching and the learning, that's the part that takes a donor a long period of time.
Hearts and minds, right?
Exactly.
You got to win hearts and minds.
Stories. So it's not that hard, because by the time you're ready to ask someone to support the organization, you've sort of earned the right to do that. Yeah. And typically if they're with you for that long and continue listening to you, they're pretty bought into what you're doing.
Oh, sure,
so the ask becomes the easiest thing. Yes. It's what leads up to that, the stewardship before and then after. So cultivating them on the front end and then stewarding them on the background, which is why you and I have remained close and friends, because it's just part of who we are now and a part of the relationship that we have. So.
Well, even with what I do in the engineering industry, I have to, again, hearts and minds, right? So if I go into Alcosan, which is the largest public utility in this part of the world, okay? If they don't like me, it doesn't matter how good the company I'm representing is, right? They're not going to get past me to them. Mm-hmm. So I have to be able to go in. If I just go in there, they know I'm coming in there because I want to get work for my firm, right? They know that. They're, So, but if I go in there like this, they're just, they'll be polite. They'll say, "It's been nice talking to you. The door's right over there. Just be safe on your way home." But you have got to present yourself first, then Brooke and everybody involved before you get people comfortable with that and make them feel like they're part of the WHS family.
Exactly.
Well, and it takes every one of our team members. When I meet with employees in new employee orientation, I always tell them that every one of them are an ambassador, and every one of them are going to interact with our patients and our community in one way or another, and the community is going to judge us instantaneously. Mm-hmm. And I always use the example of going to a fast food restaurant. When you go through the drive-through, you know before you get to the window to pay whether the employee is engaged and cares or not. That's how quickly patients judge us as well, and judge whether or not we care. And so going back to our vision statement around providing, being a leader in healthcare quality, safety, and value, remember I mentioned in that quality part of that is how we treat people.
Right.
And so, we're human, right? Everybody has a bad day, but whenever possible, we can't let the patient and the community see our bad day, because they might then go away with having a bad impression and not come back, even though they might need care.
Sure.
And so it's all about sort of how do we interact with people and how do we treat them, and in turn they're sort of going to internalize that, and that manifests into all kinds of things. Do they come back for care? Do they get the right preventive care they need? But also down the road, will their heart and mind be attached to the Washington Health System, that they want to volunteer their time and talent, maybe their dollars as well, all those kind of things.
Right. So you mentioned your board. Okay, and you have a board, and you also have a board of the foundation.
Correct.
So how are they the same? How do they interact? How are they different?
Well, I'll start, and Sara can jump in. And so, of course, we have a health system board. Okay. That entity, that group of individuals, is responsible for sort of normal governance of the company. That's all of the companies we own outright, plus oversight of the joint ventures. And so there are 16 individuals from the community who make up that. They come from every industry background you can imagine. And up until recently, they all lived and worked right here in Washington, Greene County. And so they were helping make decisions about what impacts them, their family, their grandkids. Now that's changed recently. A few of them have retired, and so they're spending time in Florida and those kind of things. But they all basically started, if not still live and work in Washington County. So they're making decisions around strategy. What's the direction of the organization? Where do we want to go? What services do we want to provide, expand, and grow, those kind of things. And of course, they have oversight of administration and of the financial situation as well.
Sure.
And then, of course, we have boards, including Sara's with the foundation and some of our other entities. And so many of those health system board members are what we call crossover board members, meaning they serve on some of these other boards. So Sara's board is not made up entirely of members of our health system board. There's a few, but then she also has community members at large that serve on the foundation board. And they're working specifically with Sara and her management team to make sure the foundation has all the tools and resources it needs. And so I'll let you add to that as well.
So the Washington Health System Foundation has 19 current board members, and the chair is Jana Phyllis Grimm. Dennis Dutton is our vice chair, and Bob Griffin is our secretary treasurer. So we have a great supportive group of, I would say, community leaders who have influence. I think 20 years ago, if we talked about how maybe philanthropy and fundraising has changed, we would have said influence and affluence. But I do think fundraising is changing, and we're not putting so much credence on affluence. We're putting credence on really influence of other people and relationship building, because that will take us to the affluent folks.
That's
so
not only what business is all about, it's what life is all about.
Exactly.
Right? Everything that you do is about relationship building.
Exactly. So we have a core group of people who care a lot about the health system and about the foundation succeeding, because they know if the foundation succeeds, then the health system and our community's health succeeds. So they go out and they prospect for us, they cultivate for us, they steward for us, and serve on different committees. We, of course, have several events that we hold, and they serve on those committees as well. So they really are a fundraising board, but then they offer their time and talents, for instance, investments and financial knowledge that they provide to us. But they are a little bit different in the sense that we all report up to the health system board. So Brook is my boss, and his boss is a couple of people on a board, basically. So that's one big difference. But yeah, great group of humans who have devoted a lot of years. We have many board members, like Brook does, who have been serving for, some of them, decades, just because they believe so much in what we're doing.
Amazing.
So
that's amazing, and it's good that you have that overlap, because it provides continuity.
Exactly.
Right?
And the nice thing is, Sara knows this very well, we have some people who are been past board members on the foundation board or the health system board, are still donors today, and they want a routine meeting with Sara and I to say, what's going on, what's the update, how are you growing this, because they care. I mean, they want to know because they care. If they didn't care, they wouldn't take time out of their day to sit down with us to learn what's going on. And oftentimes that results into, well, how can I help that initiative? What can I do? Is there someone I can talk to who can help with that initiative or grow that service line? And so that's the rewarding part. Getting back to, it's all about people, and that includes the community as well.
And Brook always comes to our foundation board members in meetings and gives an update on the health system. And I think what's hard about being a foundation board member is, and a volunteer in general, is not only do they have to understand and learn what the foundation's role is, but they have to understand the health system's vision and values, because they need to understand the core of what it is we're doing. You know, we're not just a singular organization raising money for one particular or one focused area. We're raising money for a large health system that has many different, as you pointed out, very complicated and many moving parts. And so it takes a little bit of time from their perspective to learn, if they don't have a background in healthcare, to then be able to go out and tell the story for us, which is what we want them to do, be ambassadors for us. We have a whole group of ambassadors, of folks who are leaders who have gotten off of one of our boards to be able to keep them involved with what we're doing, but also to share in the community. They're, very highly regarded in the community, and we need them to go out and tell people about the great work that continues at the Washington Health System.
Excellent. You mentioned how, would you touch a little bit on how philanthropy and things have changed over the last 20 years? What is the biggest difference that you see right now from when you started to today?
I would say the biggest difference is probably the motivation of donors. And I mean that in the sense that in the past, we could send out a solicitation letter to Jamie Protin and to Brook Ward, and you're going to be like, you know what, I really like that hospital. It's the only one. This seems pretty cool. Been around forever. I'm going to write them a check. That could have been a $10 check, could have been a $1,000 check.
Right.
And we continued doing that, and it was working for a while. But now there's this growth in the nonprofit sector, which is amazing, right? But there's a lot of choices now, and there's a lot of business development. And so the world has changed with social media and the way that we market and how things are right in front of us all the time. And so the same thing with nonprofits, where people are now able to share their story, and it's real time. So now donors' motivation is a little different, meaning they might say, I see this Washington hospital, I see this XYZ nonprofit, I see this, oh, you know what, I'm going to give to this organization this time. So I think some of the savviness of nonprofits has gotten a little bit better. There's more nonprofits than there ever were, particularly in the Pittsburgh region. And that's all great stuff, right? Because all nonprofits are hopefully doing great work and giving back. But what we're seeing is we have less donors, but they're giving more money.
It's the blessing and the curse of the internet.
Exactly.
Right?
So typically now what we're seeing is people have maybe the top 3, top 5 organizations that they know they're going to give to, and they do that. And so that may lead to less and less community members giving, but they're giving more. And so our goals, we have many of them in our strategic plan, but one key one is to raise community awareness and market the foundation and the health system, because we need people to understand that we need those $25 donations. We need them for the financial piece, but we also need it because we need you to understand and believe in what we're doing. And we need you to tell other people about it. So I feel like we weave together, meaning we're selling the great patient care that the hospital and the health system are giving to our community. And then on the same end, we're going out and telling them, hey, we need you to go tell everybody else, because we want you to use
Spread
the
the word.
Washington health system when you need your patient care. So it's sort of, to me, is like a teeter-totter back and forth, where we're sharing one another's message and mission, because they need patients and they need to give great patient care, and the way that we can support that is by working together.
And to be clear, I would be happy if no one needed our services, because that means as a community, right, we're completely healthy.
We're healthy, right.
And we're doing well. Unfortunately, that's not the reality. And so when someone needs care, whether that's preventative care or fighting an illness disease, that's why we want to make sure we have these things in place, to make sure that people can get that care locally without having to go into the city or go down to West Virginia. Because the reality is not everybody in our community has access to transportation in the things that we all take for granted.
Absolutely.
So when we can provide that locally for everyone, we all win.
I know there was one of the things that has been, and it's getting better, don't get me wrong, but one of the things that's always been the Mon Valley getting to Washington. Just public transportation from Charleroi right down Interstate 70, 20 minutes is next to impossible. Right. So that transportation piece is incredibly important. And so how do you get the message out over social media? You guys use social media and you do it well. And there are organizations that are good at it and some that aren't. What's kind of your focus or your vision for social media?
Well, we work in partnership with the planning and marketing department at the health system. So I always say we're very fortunate being a supporting organization, because we have some of the benefits of the backing from the health system, and we have that groundwork from them. So we work very closely with them. We've created some newsletters, which I've already shown. This is the health systems and the marketing, which we're privileged to be a part of.
Can people access that electronically?
They can. So they should be able to access all of this on our website.
Which is?
www.whs.org. And our marketing department said, I don't need to do www anymore. So that's how old I am. So it's whs.org.
Okay.
And we also are very active on Facebook, and we try to be active in terms of coordinating with planning and marketing, meaning you may see some things about our service lines, and then we try to intersperse sort of the stories about the community's generosity, and then how that's impacting directly our patients and our staff members. And then we also do regular e-blasts. So this newsletter that I brought, this is in print, and I know it seems archaic, but I will tell you that I think people still do like to receive some
I get it
things
in the mail, and I read it.
and they like to see it and touch it and feel it, and they want to see the colors, and they want to see if they have given a gift in memory or in honor of someone as a tribute. And so we went back to doing those in print because we feel it's very important. And as a health system, unfortunately, as Brooke said, that's part of the reality that we live in. So.
Absolutely. What I would add is we have a very lean marketing department. There's only 2 individuals there. And
They're
so,
very good.
And so,
because I've looked at your social media, I pay attention to it, I follow it, and they're very good.
yeah, and they've done a good job. And for only having a few people, they've done a wonderful job. And not only trying to maintain social media, but upping our presence, particularly around videos.
Sure.
You know, we made a
Good
decision
point.
before the pandemic to do more videos. And then, of course, the pandemic hit, and it was sort of a natural transition. So for a while, I was doing weekly updates about COVID. Those sort of
Right.
transitioned into updates about COVID and other things. And those have sort of now petered out appropriately, but they've transitioned that to a video series called Doc Talk, where they're interviewing physicians and medical staff members about what's going on. And so sometimes those 2 and 3 and 4 minute videos are very valuable because you
Absolutely.
can get a word out in a way you can't maybe through print, the website, or a billboard, that kind of thing.
Yeah,
And
it
I'd
gets
like the
people's
foundation to do more videos and
Okay.
more interviewing
Nick,
of donors.
attention. Give Sarah your
and-
business card.
There you go, Nick.
Nick's a genius with video. He's a great editor. He makes me look good,
There you
which
go.
is next to impossible.
Well, hopefully he's going to make
So-
us all look good.
Oh, he
here
will. He will.
today.
You guys will love this. So what I want to close out with is my favorite question you gave me, and that's if you
Oh,
had an
Lord.
extra $10 million, how would you spend it and why? Okay?
Well, that's actually for Brooke.
no, that's for you too because you're the one that has to go get it.
Well,
So let me ask the question here.
He
okay?
knows the answer.
I know he does. He wants the answer.
I know the answer because what interests
we've
your
actually
boss
had this
fascinates
conversation
you.
long before this podcast.
Yeah.
Okay, so in a perfect world, if you go through your budget and everything, and all of a sudden you find an extra $10 million laying there, what do you do with that and why?
Well, I think there's countless pieces of equipment, technology, and facilities that we could buy new, replace, expand, all those kind of things. And that, I mean, on a normal year, our capital budget is in the $13 million range. And we normally, through our process of collecting feedback from department directors, physicians get requests for $35 million each year. And
Yeah.
so there's just not enough resources to get
Right.
everything that our team members would like to continue to provide care. But if a donor came forward today and said, here's a $10 million donation, put it where you think it makes the most sense and would impact our community the most today, what I would propose we do is build a new School of Nursing building. And so I told you, our
Interesting.
our School of Nursing was created in 1897. We've been involved with training nurses since the very beginning. That has continued. Because of that, we have never had a travel nurse at the Washington Health System. You hear a lot about that in the news now, about travel nurses.
Oh, yeah.
We have not ever had to do that. And travel nurses are valuable and important for organizations who need them, but they're also very costly. And they disrupt the morale because you're bringing in someone from the outside to work side by side with another nurse. There's a pay discrepancy because of that situation. We've never had that. The people that care for you at our health system are our employees. Right. And we have functioned within the current School of Nursing building since the 1940s. And so it was originally not only the classroom, the lecture halls, and a dormitory for nurses. We used to have nurses who lived on our campus. That School of Nursing building, which we still call the School of Nursing, it still has the classrooms, the lecture halls, and the school embedded in it. But it also has HR, finance, the foundation, a number of other
Okay.
things. But the school facilities within it are archaic, are old, and outdated. And so if someone came and said, here's $10 million, Brooke, let's do something great with it, I would build a new School of Nursing facility. There's some space right near the hospital where we have land. And
He
we
might
could-
have thought that
He
through.
may-
Yes, I have thought
crossed
that
your
through.
mind.
and we would set up the School of Nursing to be successful for the next 50 years.
That's
and I'm
amazing.
sure even without it, the school will be successful because that's what we do. We make do with what we have. But that would set up that program to really provide nurses for our community for the next 50 years. And we do provide nurses for every hospital in this area. We have nurses that work in all 50 states who graduated through our program. A lot of them stay local, but they go elsewhere. And so it's important not only for us, but for every healthcare provider in this area.
That's amazing. That is amazing. And that's your answer as well? You concur with that?
Yes, because what the health system needs and their vision is what our vision is to follow and to provide that. So, yeah, if I have thrown it out to one entity, so you might be doing another podcast with us about how we built the School of Nursing.
There you go.
And
We'd love to do
we'll
it.
be
We'll do-
super excited. We'll
Yeah, but
definitely.
that said, if there's someone out there, you
I
got
was
$10 million,
thinking that
please
too.
call.
Send the
It
check
actually
directly.
it might end up being more than 10 by the time we start building
Yeah.
with the prices of inflation
Oh my goodness,
here.
yeah,
but-
inflation is crazy. But that's another
Yeah.
podcast again
Yes.
altogether.
Yes.
So, well, listen, this has been fascinating, and I'm very proud of both you and everything that you're doing for our community and our region. Thank you so much, and thank you for joining us. This has been great. It's a great conversation, as I knew it would be.
Thank
you
you.
so much, and it's wonderful to see you again. my
Yeah,
friend.
you too. Thanks for having us. If I could just say one thank you to everyone watching into our community. So it's been an interesting, to say the least, 2 years, and Brooke could talk about the last 2 years for probably the next 2 years.
Sure.
But, a huge thank you to our community and to everyone who supported us, whether that was financially or providing food for our staff. And Brooke touched upon some of that, and I touched upon the healthcare heroes and the spotlight
Right.
that it has given to healthcare. But, genuinely, I saw some of the most caring and giving and heartfelt emotions that I have in the 20 years that I have been serving in philanthropy and in this role. So
That says a lot.
just want to say thank you. It was very hard, but again, if there was a silver lining, I tried to find it through people's hearts and through giving back and supporting one another and rising together. So just wanted to make that point here before we end.
And I want to thank you for having us on as well. I appreciate you letting us talk about the Washington Health System, highlight the good work that's going on. And like Sarah, I appreciate what the community does for us as well. And I want to make sure we thank our Washington Health System team members. This is our physicians, our nurses, our technicians, everybody, including our volunteers and students. All 3,000 of them have come to work every day to care for our community and each other during the pandemic. And you can't ask for much more than that.
Excellent, excellent. Well, thank you very much.
Thanks,
both.
Jamie.
Yeah, thank you.